This lecture is on superspreading events. So I'm just going to give you some examples now of events that turned out to be superspreading events. So the first one that we were aware of was the choir in Washington State. So what did we see there? This was the, this was the Skagit County, or this happened in Skagit County in Washington State on March 10th. So when we were aware that the coronavirus existed, but it wasn't really fully understood that it had arrived in the United States and had arrived on the West Coast. So these people did not know at that point that they were endangering themselves. So on March 10th, then, 2020, and what you had was 61 people attended a choir practice. Now, at this point, people were worried about the coronavirus. We knew that it had come to some places in the United States. We were aware that it was a problem. So people were already doing hand washing and things like this. But as I said, then, despite at least a little bit of care in trying to avoid transmission, they still wound up getting a bad event. So this was a choir practice, and there was one person had COVID-19 and had symptoms. But remember, the symptoms are often similar to having a cold, things like that. So people at that point tended to discount kind of ordinary symptoms like coughing. But as I said, they were already taking some precautions. They were already doing a lot of hand washing and things like this. But it was a 2.5 hour choir practice. It was indoors. People were singing. So there was lots of expelling of aerosols, and apparently speaking and singing is more likely to result in infectious aerosols than just plain exhaling, but just plain exhaling can do it as well. So we had 61 people in an enclosed space, a fairly small enclosed space, singing for the better part of 2.5 hours. And the result, then, was that 52 people got sick. Three were hospitalized. And 2 died from one choir practice where people didn't touch each other. So that's an 86.7% transmission rate. That is to say, from that one person who was infected, 86.7% of all the people in the room wound up getting the disease. Also, a 5.7% hospitalization rate. And a 3.7% death rate. So if you go to an event where there are 100 people there and one of them is sick with this, you may wind up with 3.7 or nearly 4 people dead as a result. So just to reiterate, this type of event is called a super spreader event. Where one person manages to give it to so many other people. And this event alerted U.S. scientists to the possibility of aerosol transmission. Since the choir made a point of not touching each other. However, aerosols were not fully accepted. As I will say, as an important route of transmission. Okay, so that then is the choir practice in Washington State. Sort of the first super spreader event in this country that was understood as such. But there was an earlier super spreader event that we did not know was happening at the time, and that happened here in Boston. So this then is the now famous or infamous Biogen Conference. In Boston, Massachusetts, from February 26 to 27 in 2020. So this really was when we knew there was a virus in China. And it had gone elsewhere, but we didn't realize that it had gotten fully here. At the time, there was one student from Wuhan, China, who had come to Boston, and he self-isolated, and there appeared to be no further spread from that individual. So Boston thought it was doing pretty well. Meanwhile, this was going on. So this was before much was understood about SARS-CoV-2. And as noted above, that choir practice hadn't happened yet. So aerosol transmission was not thought to be important at that time. And genetic lineages of the virus have been studied. This is part of the way that we can tell, in some respects, who got the virus from whom over many degrees of transmission. So genetic lineages of the virus have been studied, and it now appears that, and I'm not joking here, that 20,000 cases eventually, I will say, arose from this single conference. So let's take a moment now to actually look at sort of the conditions that led to this. First off, as I said, this was before we were terribly concerned about the virus. But in addition, it was at a hotel called the Marriott Long Wharf Hotel. And I'm bringing this up only because people go in and out, and to and from the waterfront. What I'm getting at here is that people might go into that hotel who are not staying at that hotel. It's right at the waterfront. It is a way of getting to the waterfront in many cases. So a lot of people will pass through that hotel lobby and maybe go to restaurants and get a cup of coffee there and the like, because it is on the waterfront in a very desirable location near lots of places where the general public goes. So that's one thing. Second, This conference drew attendees from all over the world. And this certainly would have included scientists from China, scientists from Italy, where the virus had already spread, possibly Korea and Iran and places like that, or South Korea, I mean, and places like that where the virus had also already spread and maybe people weren't fully aware of it. So, as I said, we had people coming in from all over the world. And what those people did when they got there was go to a conference. So they packed into hotel elevators. And onto escalators. Sat near each other. At meetings, and some of those meetings were in small rooms. And of course, they socialized. Over meals and drinks, talking, more aerosols, drinking, spending a long time talking to each other at close range. And the conference took place before many Americans took precautions against COVID-19. So, capacity, that is to say the number of people in the room. Capacity was not reduced. This obviously was before shutdown. And before people were doing social distancing or wearing masks. So the Biogen conference was a really big super spreader event, but it's also understandable because it was before we knew that the virus was here in Boston. People were not yet fully aware. We were completely unaware of aerosol transmission. And so as a result, this was, as I said, in the days just before it became clear that this virus was here and was spreading in the community, not just from known cases where we knew who came in and what had happened, but rather where it was just kind of mysteriously dispersing in the general population. So as a result, this one happened early, and because there were so many people, it wound up being a serious super spreader event. But the events continue to take place. Here's another one. There is now the unfortunately famous wedding in Millinocket, Maine. So this has killed people who weren't even at the wedding. And even at the third level of association. So people died who did not even come into contact with people who had been at the wedding. People died who had not been at the wedding, and they were not in contact with people who had gone to the wedding. They still died. So this was an August 7 wedding, so long into the time when we knew what was going on with this virus. So there was a ceremony at an East Millinocket church. And a 62-person reception at a nearby inn. That's an inn, sorry, at a nearby inn. And the guests did not wear masks, or do social distancing. So look at the ingredients that we've got here. Indoors, this was in a church and in an inn. 62 people, no masks, no social distancing, over quite a long period of time, because you do not have a wedding and a reception in just a few minutes. Now here is a kicker. No one was symptomatic. The following day, one person reported having symptoms. So this was a 62-person event. One person had symptoms the following day, and as a result, 177 cases of COVID-19 have now been linked. To this event. And these cases then are either in people who attended the event, or who caught it through further transmission. And caseloads of this disease were very, very low in Maine at the time. There was a very low incidence of COVID-19 at the time. So it was really easy to see the results of this wedding and how it went through the population. So as I said, they caught it either at the wedding itself or through further transmission. You may notice that 177 people is far more than the number of people who attended the wedding. It's more than twice the number of the people who attended the wedding. And this includes transmission to people in a nursing home, and to a jail that is over 200 miles away. And 8 people have died so far. And none of them attended the wedding. Seven of those deaths are in the nursing home. That is still trying to control the outbreak. And the nursing home transmission was the nursing home transmission then was third hand. That is to say, it started after a worker at the nursing home caught COVID-19 from a parent. So one of the workers' parents got it. Who had caught it from a different child who was at the wedding. So that's what created this outbreak, at which 7 people have died, was somebody went to an irresponsible wedding. They gave it to their parent. That parent gave it to another of that parent's kids. And that kid, that adult kid, who's a worker at the nursing home, wound up giving it to people in the nursing home, and 7 of those people have died. And then another woman who lived independently so was not in any kind of a care facility then. Another woman who lived independently also died from third-hand transmission. And Maine then had an overall low incidence of COVID-19. So this event was relatively easy to trace as a spreading event. And it shows that even in areas with low COVID-19 incidence, spreading events can occur. And they can harm innocent people. Who were never even at the event. And who were nowhere near the event. So that's the end of this lecture on superspreading events.